Good morning, viewers. I am Dr. Sankar Narayanan, practicing oral medicine and radiologist for the past 12 years. Today, we are going to see about only the chairside investigations. Okay. So, what makes temporomandibular joint so special? The temporomandibular joint is one of the most complex joints in the body. What makes it so special? Because the temporomandibular joint is one joint that provides both hinging and gliding movements in one single plane. When I am talking about hinging and gliding movements in one single plane, what am I referring to? Always remember, no other joint in the body provides these movements in only one single plane. When I am going to talk about hinging movement, I am going to talk about opening the mouth. When I am going to talk about the gliding movement, I am going to talk about the front and back movement of the joint. So technically, this joint is called as gangliomo-orthoidal joint. Why it is gangliomo-orthoidal joint? Because it provides both hinge movement and the gliding movements in one single plane. That makes this joint so special. Now we are going to see about the clinical examination part. The clinical examination part of temporomandibular joint begins with manual or digital palpation. When I am going to talk about the examination of temporomandibular joint, I am going to do the digital palpation or manual evaluation of the joint. The digital palpation of the joint is done by placing the two index fingers along the lateral pole of the condyle, just in front of the ear, okay. If you have any uncertainty in placing the exact location of the condyle, kindly remember or always ask the patient to open and close the mouth multiple times, and this will give you the clue regarding the exact position of the condyle, so that with ease you can place your fingers. So what is the need to examination of the temporomandibular joint? Yes, I need to examine this temporomandibular joint when there is any pain or dysfunction associated with the temporomandibular joint. When I am going to talk about the pain associated with the temporomandibular joint, while placing the fingers along the condyle, I am going to apply a mild digital pressure along the condyle. This will aggravate the pain. When I am going to talk about the dysfunction, now what do you mean by the word dysfunction? See, the temporomandibular joint is responsible for closing the mouth and is responsible for mastication. Always remember, not only opening and closing mouth, during mastication, your joint will move in both right, left direction, up and down. Right, left, up and down, the combination of these movements will contribute during your mastication. So hence you have to be very careful while digitally examining the temporomandibular joint. What dysfunction you are going to examine during the temporomandibular joint? Ask the patient to open the mouth and see to that if the patient opens the mouth in the same direction without any deviation. When I am talking about deviation, the jaw will move towards either right side or left side. You have to very clearly look for any deviation of the temporomandibular joint. Okay. If there is any deviation that goes towards either right side or left side, always ask the patient to still more open the mouth widely, and you have to see whether upon wide opening, whether the mandible comes back to the same position or it returns to the midline. If there is any such dysfunction is present, it is called as deviation. asking the patient to open the mouth. If there is any deviation towards the right side or left side, again upon opening it comes back again to the midline. Such dysfunction is called as deviation. Always examine for deviations. These deviations will give a clue that the patient might have a temporomandibular joint disorder. Now what's next? Yes sir, I have done this. There is no deviation. Either the deviation should be present or there should not be any deviation for this patient. After examining this deviation, what I am going to do the next part, kindly look for any deflection. Now what is deflection? Ask the patient to open the mouth. When there is deviation towards either right side or left side and it does not return to the midline, that is called as deflection. These are the most common dysfunction associated with the temporomandibular joint. Either there will be a deviation dysfunction or there will be a deflection dysfunction. Okay, this you have to examine very carefully, because each of either the deviation dysfunction or a deflection dysfunction will give a clue that either the disc or the joint has got some sort of trouble which needs your attention. Next, after examining these for any deviations or deflections, what I should do for the next? You examine the lateral movements of the joint. How can I perform the lateral movements? How can I examine the lateral movements of the joint? Ask the patient to clench the teeth. Okay, then what you do is you mark the midline on the upper central incisors and the lower central incisors. Ask the patient to move towards the left side or right side on mild biting. Okay, then you just measure how far it is deviated from the right side or left side. Any jaw deviation that is less than 8 millimeter from the midline towards right or left is considered to be a restricted movement. Any restricted movement will have a strong intracapsular connection. So that has to be noted very properly. So technically these points are very essential for the evaluation of temporomandibular joint. I repeat, first, by digital palpation we will place our fingers on the condyle. Okay, if there is any uncertainty exists in locating the condyle, ask the patient to open and close the mouth 2-3 times. So this will indicate the position of the condyle, or this will give the clue where the condyle is located, so that with ease you can place your fingers and easily locate the condyle. Having located the condyle, first you have to do is apply a mild digital pressure. If there is any pain that is elicited, the patient will say it is painful. So you are going to evaluate the temporomandibular joint for pain. That is the first point. Next, what you have to do? You have to elicitate the temporomandibular joint for dysfunction. How am I going to evaluate the temporomandibular joint for dysfunction? Yes, by opening and closing the mouth. Ask the patient to perform opening and closing function. When the patient opens the mouth, you see for any deviation towards right or left side. If you find the deviation towards right or left side, ask the patient to again open the mouth widely and you check whether the deviated side again returns to the midline where the opening has started. If such the case is present, then it is called deviation. Kindly look for deviation. These deviations will suggest for any capsular disorders. Having noted the deviation, again you look for any deflection. What is the deflection? Ask the patient to open the mouth. It will permanently move towards either right or left side, will not return to the midline. That is called as a deflection. So the temporomandibular joints have been first evaluated for pain and now it has been evaluated for deviation and deflection. Having evaluated for pain, deviation and deflection, the third most important thing what you have to do is you have to look for the lateral movements of the joint. So how do I perform the lateral movements? I'll just ask the patient to clench the teeth. I'll mark the midline in the upper and the lateral incisors, upper central incisors and the lower central incisors. Okay. Then I will ask the patient to slightly move the jaw on the right or left side in the closed mouth position, and I will measure for the deviation. Any deviation that is less than 8 millimeter in the right or on the left side is considered to be a restricted lateral movement. All these are very significant. A painful joint or a deviated joint or a deflected joint or a restricted lateral movements, all these signify that there is actual problem existing in the temporomandibular joint. If all these things are normal, then it is a normal temporomandibular joint. If these things are present, the patient should be evaluated further. It will signify either a joint problem or an intracapsular problem. So this finishes the clinical examination of the temporomandibular joint. Okay. Now I am going to demonstrate clinically how the temporomandibular joint is being clinically evaluated. So this is all about the examination of the temporomandibular joint. Now we move on to the clinical demonstration of the temporomandibular joint. Now we are going to see the clinical demonstration of the temporomandibular joint. The temporomandibular joint are generally examined clinically by placing the index finger in front of the ears and feel for the lateral poles of the condyle. For the beginners who have uncertainty where to feel or touch the condyle, ask the patient to open and close their mouth. Open. While opening, you just look for a dip or a depression in the preauricular region. This is the classical key. The condyle is exactly in front of this preauricular dip, and this is the tip for the beginners, those who cannot directly feel the position of the condyle. If you have any uncertainty in feeling the position of the condyle, ask the patient to open and close the mouth. While opening, you just look for the preauricular dip and place your fingers just in front of the tip, and this will give you the position of the condyle. Now where I have placed exactly is the lateral pole of the condyle. Close. So this is the first step in identifying the position of the condyle. Now that we have identified the position of the condyle, now we are going to apply a gentle pressure over the joint and look for the patient's response. Has he got any pain or not? A normal patient will not have any response. The patient who has pain will elicit a response. Now that after assessing the response of the pain in the joint, now the second step is to go for any dysfunction associated with the joint. The dysfunction of the temporomandibular joint can be clearly assessed by making the patient to perform the functions associated with the temporomandibular joint. Ask the patient to open the mouth. Okay. While opening the mouth, make sure or look for any deviations. Open. While opening the mouth, look for the jaw deviation. The jaw might sometimes go towards the left or right side, come back to midline. Yes. While opening the mouth, the jaw or your lower jaw might deviate towards either right or left side and then come back to the normal position. So this is called as deviation. Open, it will deviate to either right side or left side, and then wide open, it will come back to its original position again. This is what is called as deviation. You have to very clearly look for deviation. What is the purpose of looking for deviation? Deviation signifies temporomandibular disorder, that the patient might have a problem associated either with the joint or with the disc or with the muscle. Next, we are going to look for any deflection is there. Yes. Deflection is nothing but when the patient opens the mouth, the jaw will deviate towards one side, that is either towards the right or towards the left side. That will not return to the midline unless an external pressure is applied. This is what is called as deflection. That's the basic difference between deflection and deviation. Any deviation that do not require external assistance, the jaw will deviate and it will come back to its original position again, whereas deflection, deflect. Whereas deflection, the jaw will deviate towards one side and external pressure is required to bring back the jaw to its original position. That's the difference between deviation and deflection. By keeping these two things in mind, now that we have seen the pain over the joint and now we have checked the joint for any dysfunction in the form of checking deviation and deflection. The most important part of this TMJ examination is to look for the lateral movements. Coming to the lateral movements of the joint, how to assess the lateral movements of the TMJ. Mark the midline with the help of pencil in between upper central incisors and lower central incisors. This is the first step. Now, we ask the patient to move towards either right or on the left side. Ask the patient to fix it in either one side. Keep it like that, keep it fixed. Now that we are going to take the divider and now we are going to measure the distance. Okay, I have measured the distance. It is 10 millimeter or 1 centimeter. Any movement that is less than 8 millimeter is considered to be a restricted movement. Any restriction that signifies a deranged disc, it signifies that there is a typical disc problem. Repeat the procedure on both the sides and measure the distance and look for the lateral movements of the joint. Repeat on the same side, this side, same side. You just measure and then repeat the same on both the sides. Okay, relax. So this finishes the examination of the temporomandibular joint. The temporomandibular joint was first assessed by placing the fingers over the lateral pole of the condyle. For the beginners who have any uncertainty in palpation, open the mouth, you will feel a preauricular dip. It is exactly in front. That's the key. Okay, the preauricular dip is the key. It will be always in front. Now, keeping this landmark in mind, just place your fingers over the lateral pole of the condyle, mouth closed. Okay. Now that after placing your fingers over the condyle, check for any pain, apply a gentle pressure. Either there will be no response or there will be a response. Okay, this is a painful response. Now that after knowing that there is pain in the joint, we are going to check for the dysfunction of the joint. The dysfunction is checked by making the patient to perform the functions of the TMJ. Ask the patient to open the mouth and close the mouth. Open. This opening without any deviation or deflection is the normal mouth opening. Next, we are going to check for any deviation. Okay. So, if there is deviation towards either right side or left side and then it comes back to the midline, it is called as deviation. Next, upon opening, the jaw deviates towards one side, that does not come back to the midline again. The basic difference between a deviation and the deflection is, during deviation, no external support is required to bring the jaw to its original position. In deflection, you need an external support to bring back the jaw to its original position. Okay. These joint pain, deflection and deviation signifies that there is a problem in the temporomandibular joint, or it signifies temporomandibular disorders. Okay. Keeping this in mind, we need to assess the lateral movements of the joint. The lateral movements are assessed by marking the midline between the upper and the lower central incisors, and the patient is asked to move the lower jaw in right side or along the left side, and you just look or measure the distance between the two markings, measure with the help of the scale. Any numerical measurement that is less than 8 millimeter is considered to be restricted joint. These restricted joint signifies temporomandibular disorders. So, this finishes the examination of the temporomandibular joint.